Same here. Nice to meet you.
How did you find the conference?
It was amazing. Lots of information, lots of networking. Amazing.
All right. That's really nice. So what do you do?
I'm currently an ultrasound lead in the NHS.
Well, that's really nice. I just have a couple of questions for you. Won't take too much of your time. And the first one I've got here is, which interview question do you think that every radiography applicant should prepare for?
Wow, that's an interesting one. I think I'd say a question on safeguarding. It's part of the requirement that we must ask a question on safeguarding. Now, the question might not come out directly.
Okay.
It might be, you might get a scenario. So the first thing you need to do is actually link it to safeguarding and then answer the question, making sure that you're talking about first picking it up, talking to the patient, taking the next step of escalating it to the right channel, following the trust protocol.
Okay. Well, that's really nice. And just so we're clear, you're ultrasound lead, you said, so you're more into sonography.
Yeah.
That's fine. So the next question I'm going to ask you is, what is the toughest interview question that you have ever been asked as a sonographer?
I think this would have to be from my most recent interview.
Okay.
And obviously it was for a management post.
Yeah.
Because I didn't necessarily come from a background where I was doing any managerial role or tasks. It was quite difficult for me because it was strange. So the question was about finance and procurement. And so what I did was basically try to relate or think about things that had to do with procuring the machine, and when the clinical app specialist came, and when we had to try different, when they came to do different demos, so I thought about that. I said what I could about that. And then the other thing was a question about DMO1, which talks about it's a monthly diagnostic system thing that is run to kind of look at the waiting lists and activity, data collection and provision for the NHS. So it was something that was completely new to me. I tried to say what I could, but obviously after that interview, I went back and I read about it. Although I got the job, but it wasn't conducive for me. The next time I did an interview, I got the same question. So it was really helpful that I went back to read it up.
Oh, that's really nice. So, and I think what I can take from this is the fact that when you do have an interview, it's really important that you go back and look at them again, because you never know, they could ask you that again in the next interview. Correct. And that's exactly what your case is, isn't it? And so it was really helpful that you did that. Oh, thank you so much for sharing that.
Thank you.
So the next one that I would be asking you, especially because you're an ultrasound manager, right? And you would have done this a couple of times. So if you were interviewing a new sonographer right now, what is one question that you would definitely ask them?
Okay. One of the things I would ask them, and I'll tell you why, is I'll ask them what skills and unique attributes they will bring to the team. Now, that will tell me a lot about your personality. And I'm going to be honest with you, I would find out if you will be a pain to me as a manager or you'd be a delight to be managed, So it's the things that you would say, I'd want to hear things like, your limits, that you're teachable, that you would go out of your way, to support the team, that you're a great team player. So those are the things that I would want to be looking at. I'm trying to kind of sieve out from your personality to make sure that when you come into the team, you would be an addition rather than a problem.
That's a very, very nice one. And I like the way you've elaborated as to what you would expect as an answer, because that would be very helpful to those who are watching, not just a question, but what is it that a manager really expects you to say when they ask you a thing like that? So thank you. Thank you so much.
You're very welcome.
All right, that's fine. So the next thing I'm going to ask you is, what is one piece of advice that you would give to someone who is preparing for their very first NHS radiography or sonography interview?
Okay, so I'm assuming that this would be more for new migrants, or you've just qualified from the university?
Yeah, it involves them too.
Okay, so I think the very first thing is you get advice from people who have been in the system for a long time. That's very important, because they can explain what the working process is in the NHS, because that would kind of be new to you if you've just migrated from another country. That's one. The other thing that's important is that when you go for that interview, you need to actually express the fact that you understand that there will be some difficulty in transitioning from a different country to the United Kingdom.
Yeah.
And so as a manager, I want to see that you will be adaptable. I want to see that you will be teachable. I want to see that you understand your limits and that you're always willing to get guidance, that you're not going to just take a decision because you have prior experience, which may not necessarily translate exactly to what we want in the NHS. So it's important that you demonstrate that. We want to also see that you're able to communicate effectively in the way that's expected, in the NHS, with respect, with empathy, also, like fulfilling all of the core values of the NHS.
Yeah, I think that's really nice. Yeah, because it is a totally different landscape when you're talking about working outside of the United Kingdom as a whole and working here, even though the basics may be the same.
Yeah.
But the translation might just be a little bit different. So you just need to adapt your practice to what is obtainable here, which is what you're saying. And I think that's really nice. It's very, very good advice. Thank you so much. Thank you.
I also want to say that it's also, you must mention this, okay? That you're very open to understand the guidelines and the protocols. You need to use those buzzwords. Adapt to the guideline, to the protocol, and you're willing to change your practice to just kind of adapt to what is needed in the department. That makes sense.
Yeah, that makes a whole lot of sense, because it's very necessary, because even the little things can actually cause you so much grief, things that are avoidable.
Yeah.
And it's really important to stick to the guidelines and the protocols wherever you're working. So I completely agree with you. And I think that's really nice.
One more thing,
yes.
Okay? Please go straight to the point. Try as much as possible. So when you ask that question, stop for a second and think about the question. You don't necessarily answer the question honestly from your heart. You answer the question giving the panel exactly what they want to hear. And that's important. So you're not telling them what you think, but you're telling them what they want to hear. So you think about that. And that's why it's important that you expose yourself to people who can give you that support. And that stops you from just saying things that are unnecessary. Because when you come into that interview, every question is timed. And you can spend your time saying all the wrong things, but not actually answering the question correctly, and you get no marks for it. So it's important that you're going straight to the point and answering the question.
Oh, that's very good advice as well. I think some interviewees, basically those who are coming for the interview, they don't quite understand that there are timings for the questions that they are asked. It's something that I didn't even know initially, but when you come for interviews like that, apparently per question, there's a time for it. And if you spend all your time rambling about, you just might miss the mark, isn't it?
Yeah.
So that's really good information to put out there. So thank you. Thank you
You're
for that.
very welcome.
All right. Thank you for having me.
Thank you so much.
Thank you. All right. Do take